Good evening, everyone. My name is Jay Donecker. I'm the candidate for the North Carolina House District 65. Tonight, I am proud and pleased to be presenting Dr. Ron Flack, who will speak to us about the opioid disorder problem, specifically for Rockingham County. I would like you all to be aware that Rockingham County is in the top 10 of the most seriously affected counties per capita in North Carolina. Also, please be aware that over the last 10 years, our annual budget for North Carolina has ballooned by $10 billion in addition to what it was 10 years ago. With that ballooning of that budget, we have failed to meet the needs of addressing opioid misuse. And there's a number of different pieces that I would like you to pay attention to for Dr. Ron Flack's presentation. The first is the mental health aspect, of which we have privatized. And in my words, we have walked away from delivering good mental health care in Rockingham County by privatizing it and forcing people to go to other counties for treatment and evaluation. Secondly, there's a medical aspect to this, which also, by turning our back on Medicaid expansion, has also limited the resources necessary to treat this problem, which Dr. Ron Flack will outline the severity here in Rockingham County. With that said, a couple of housekeeping items. The first is this is being recorded. The second is any questions that you have of Dr. Ron Flack, please enter them in the chat feature, and we will ask those questions at the end of his presentation. With that said, I am extremely pleased to present to you Dr. Ron Flack, who is a native son of Rockingham County. So if there's anyone in dealing with this issue that knows the complexity, not only of the problem, but also of delivering its treatment to Rockingham County, it is Dr. Flack. He is a true believer in serving his community and our state. He served on various boards, groups, initiatives, and caucuses that have focused on serving those that struggle with substance abuse and mental health disorders. Some of those boards have been the North Carolina Association for Treatment of Opioid Dependence, the MH/SA/IDD Prevention Coalition of North Carolina, and the North Carolina Substance Use Disorder Federation, which is a trusted arm of the Governor's Institute. With that said, let's turn the hosting feature to Dr. Ron Flack Jr., and the floor is all yours, Dr. Flack.
Excuse me. It is indeed a pleasure to be with you all on this evening, and to our gracious host, Mr. Jay Donecker. Thank you so much, sir, for this time and this opportunity to share with your audience. And for those of you that have come on to be a part of this moment, we are excited to share great and valuable information, and hopes that this will assist us with the ever-growing problem that we face across the country, but unfortunately an ever-growing problem that is killing, hurting, impacting family members and friends right here in Rockingham County. I came to Rockingham County tonight to physically do this presentation. And what better place to do it than the place that raised us and allowed us to have this time. So want to directly get right into our presentation. Please allow me some grace as we do this, because I want to ensure that everyone can see my presentation. So give me just a second. Let's switch over here. All right. Can you see my screen now?
Yes.
Perfect. All right. Again, excuse me for the slight delay. Technology at moments has a mind of its own. But again, we are honored to be here with Mr. Jay Donecker and to have this time to share concerning the ever-growing problem in Rockingham County. Of course, our objectives for this evening we will be discussing the Rockingham County population statistics, just to get a breakdown of what our county looks like in terms of who lives here, because when you know who lives here, then you know who's directly being affected. We're going to also discuss the disease concept of addiction, just to ensure that we all have a fundamental balance of foundation to ensure that we understand what's what. We will also discuss what is opioid use disorder as it relates to the foundation of the disease concept of addiction. We're going to also discuss how has this disease affected Rockingham County. It is something that many of us over years past have watched on television, how it has affected other parts of the community and country. But we want to make sure that we understand that this is a problem that's affecting us right here in Rockingham County. The next question we'll be answering is, how do we combat this problem in our community? What are the resources that are available? We're going to discuss that. A part of us addressing this problem is dealing with the stigma, the misinformation, and the miseducation that's already been provided. Unfortunately, there's some misinformation and some stigmas that affect how we view, how we see, and how we look at treatment as a whole. Next thing, of course, is we're going to discuss the treatment options in our community. We're going to discuss some of the barriers that have unfortunately been placed or have grown into barriers in our community right here that is affecting individuals to get to treatment and recovery. And then, of course, we're going to discuss Rockingham County, we must have a voice to be able to speak to the nature of our issue and our problems that we have. Of course, my name is Ron Flack Jr., as Mr. J. Donecker alluded to. I am a Rockingham County native. I'm from Reidsville, North Carolina originally. I was born right on Highway 14 at what was once then the Moorhead Hospital. My doctor's name was Dr. Edgar Little, who is no longer alive, but he was one of the best childhood doctors that anybody could ever have. So I have a long history here of Rockingham County. This is my first love. The place that I was born and raised gave me so much as far as a proper paradigm, hard work, loving individuals. We've always been a small town, and though it's small town, everyone knew everyone. So I was raised in an area and in an era where if you did something mischievous in town, you would be scolded by that individual in town. And by the time I made it home, my mother or my father would also scold me as well. I'm from Reidsville, North Carolina, where I still believe there are some amazing and great people that reside here. There is a personal long-term history of recovery within my own family. Generations of individuals have struggled with substance abuse over a period of time, as well as undiagnosed mental health. And of course, now being educated, being trained, I now can understand why certain things happen the way that they happen. But in our families, we understand and know that these things occur. And at moments, we can also know that things go undiagnosed, and sometimes not knowing, which is where the misinformation comes by. We can kind of shove it off as if something is their problem, but not understanding this is a tribal problem. We have over 15 years of opioid use disorder treatment experience that we've been able to acquire over the last number of years, where we have served collectively up and down the East Coast families that have struggled with substance use disorder. And we've also struggled with individuals, we've also served individuals that have been struggling with this particular disorder. I am also a pastor. I pastor some amazing people in the city of Greensboro, Victorious Praise Worship Center. We've been pastoring now for 8 years, and we have an amazing group of people that I am so honored to lead and to be the watchman of their soul. I'm also a serial entrepreneur. We own a few drug treatment programs, a few mental health programs, along with a nonprofit organization that I'm so graciously able to serve alongside of my dad, which is the Flack Foundation. I definitely want to give a shameless plug there. I'm a father. I'm a grandfather. I'm a father of four. I'm a grandfather of four. And I have the most amazing woman in the world as a wife, Lady Erica Flack. I believe she's on tonight. And so we have been married 15 years. One of the things that I always know is that if I ever want the opportunity for life to be better for those that I love, I've got to do my part. And in understanding how to do my part, information, I believe, is the key for us to be able to do what we need to do. When we went and looked at the census.gov for Rockingham County, as of July 2021, there are 91,000 people, a little over than 91,000 people that reside in Rockingham County. Of that 91,000 people, we have 5% of our population that are under 5 years old. That means there's a rising generation that's coming after us who hadn't even literally lived yet. Many of them have been born during COVID. And so we know that there is this generation that's coming we're responsible for. Persons under the age of 21 years old, it's 20% of our population. Again, these are individuals who I can remember before I turned 21 how my mind was. They may think that they know, but they have no clue yet. Life they haven't necessarily experienced at the magnitude that it could be for them. We have a responsibility to give answers to that particular group and population. Then this particular group, my hat and my heart has gone off to. These are persons 65 years or older. This makes up 21% of our population. These are individuals who, according to statistical understanding, should be either preparing for retirement or have already retired. One of the things that I'll slide into this particular area of our presentation is one of the particular treatment centers here in Reidsville that we've been able to serve. One of the major caveats that I've seen is this is the group that unfortunately has continued to grow with opioid use disorder problems. 55 to 65 years old. I'm seeing more individuals that we are serving who are struggling with opioid use disorder. Why, you ask? Why at this stage of their life, those individuals are deciding to use opioids? Well, when insurance increases, some may not necessarily qualify for AARP. They may not qualify for state assistance. They have to make a decision between eating or buying medication. And unfortunately, some of their resources have led them to try out street drugs. That has become their choice to deal with pain, with whatever situation that they may be dealing with. And unfortunately, this group is growing. This means that those that should be passing us wisdom, those that we should look to for wise counsel, those that we could look to for encouraging words, they're the ones now that's struggling with opioid use disorder right here in Rockingham County. Females make up 51% of our population. Caucasians, of course, make up 76.9%. Our females in our treatment programs here in Rockingham County are, again, about 50% of our population are females. So we have to give notion and answer to that. We have to provide women's assistance and help. One of the things that I definitely want to make sure that I communicate and share is that our women's shelter that we used to have right here in Reidsville is no longer. That's an answer and a problem that we've got to address. Caucasian, 76.9% of the population in Rockingham County is made up of Caucasians. African Americans, 19.2% of our population. Then we have with Latinos, Asians, multiracial, and other nationalities, 3.9%. We have a mixture of individuals, but we also understand and know that our problem continues to grow. And these particular groups of individuals that we have itemized based upon our population are heavily affected by opioid use disorder. As it relates to the disease concept of addiction, because I want to make sure we understand what is this opioid use disorder? What does that mean? According to the American Society of Addiction Medicine, or ASAM, addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. I want to make sure that that's real clear. It's a treatable, but it's a chronic medical disease involving complex interactions among the brain circuits, genetics, the environment, and an individual's life experiences. All of these things can make up the fact that addiction can exist in an individual. There isn't just a one-sided thing. It could be my brain circuits. It could be my genetics. It could be the environment that I was raised in. It could be my life experiences. All of these things play a major role in why addiction can exist in one person and not exist in another person. People with addiction use substances to engage in behaviors that become compulsive and often continue despite harmful consequences. This is when we begin to deal with the difference between substance use and substance abuse, and then we even can migrate to substance dependency. Substance use is exactly what it is. It's when an individual uses it. When we transition to substance abuse, this is when a person literally, just like the word, abuse a substance. But then when that person abuses it long term, they can become dependent. This is when the body responds in such a way that they cannot function without the substance in their body, which means they become dependent upon that particular substance. According to the World Health Organization, about 275 million people, or about 5.5% of the global population aged 15 to 64 used drugs at least once in 2019. This means that just before the world pandemic, we still had an epidemic occurring. Oftentimes in my genre and in my population in which I work in, and those that work in behavioral health, we've been saying since the pandemic began, we are still fighting an epidemic in a pandemic. And it's something that unfortunately, during this pandemic, which we all know has majorly affected all of us, to the friends and to the family members that we all have lost, we definitely want to give a moment of opportunity of just remembering for them. On the backside of all of this, we've got to also know there have been individuals that still continue to die due to opioid use disorder. This means that about 36.3 million people suffer from drug use disorders in 2019. So to understand this more effectively, what is opioid use disorder? Opioid use disorder is a medical condition defined by not being able to abstain from using opioids and behaviors centered around opioid use that interfere with daily life. That's according to our ASAM, that we understand and knowing that to have an opioid use disorder, this person is making a decision to use a drug without understanding in context, not taking in consideration what the consequences are, because their body is telling them, I've got to have this substance so I don't hurt, so I can function, so I'm not sick. We also connect this opioid use disorder that when the previous slide communicated that there's a brain malfunction, what happens in addiction is the frontal lobe, which normally, if I had an opportunity, I would show you, a normal brain has a stop and go process. We know when it's not enough. We know when there is too much. Same thing with eating your favorite ice cream. You know when you've had enough. Well, some of us know when we've had enough. When you're eating your favorite cookies, some of us know when we've had enough. What happens when a person is struggling with addiction? Their frontal lobe, their stop and go process, there is a disconnect between the communication in the brain from how their body is feeling to what's happening from their brain. And unfortunately, this person no longer considers the consequences because of how their body is feeling. And there is no governor within the frontal lobe. All they care about is not feeling bad. And I want us to understand that it's not just as easy to say, I'm going to stop. I understand and I know the major issues that addiction has caused families. I've been treating them for 15 years, the damage that it's caused. But there is an other side of this coin for the person that's struggling with this disease that has come to my office and have cried and said, Dr. Flack, nobody understands how I feel. I don't want to be like this, but there's something in me that won't let me let it go. And that's literally how this disease does. It's very much so like the frontal lobe struggles with knowing how to function, very much so like a pancreas not functioning with insulin. And that person has to take medication to offset what's happening in that pancreas. Oftentimes, those that are struggling with opioid use disorder, which we'll get to, they have to alleviate these symptoms with taking the medication to help them find their baseline so that they can function as an individual and be a productive citizen within their families and in their own lives. As it relates to North Carolina, and all of my information comes from the North Carolina Injury and Violence Prevention, which is a segment of our North Carolina Department of Health and Human Services, provides information on a monthly and yearly basis of data that we can all grab, that we can take and really help us understand where our major problems are. How has this disease affected North Carolina as a whole? I want you to see that as of last year, we had 604 overdose deaths or overdose emergency department visits. That's not including the people that called but didn't go. I want to make sure that that number is understood, that this is 604 people as of last year who went to the hospital. But if Buddy or if John gave Narcan at home and they decided not to go to the hospital, that was a number not included in this particular presentation. But as of last year to this year, you can see, as of May 2022, we have 760 opioid overdose ED visits that have been accounted for. That means that this number has increased in such a way that we're back at the same problem we were before the pandemic. This is a problem. North Carolina is every day. So what this means for North Carolina and what this means for us as a whole is that our population, and these are the areas, and you can see the hotspots where we see individuals that are unfortunately struggling with this particular disease. More of our citywide areas, we have these problems. But if you look up at the top, let me go back, I'm sorry. If you look up at the top, Rockingham County is a blue area. Rockingham County is in the top 10 counties of North Carolina. There are 100 counties in North Carolina. We're the top 10 of overdose deaths amongst all other counties in North Carolina. This means that we are in the top 10 within the areas of Asheville. And even when we go to the East Coast, and even when we go south, I want you to understand that Rockingham County is a small, small town. It's built of small towns. How did we get to where we are? It means that we've had a problem for a while and it hasn't received the proper attention that it should have received. As it relates to opioid overdose deaths, based upon other North Carolinian residents, we see that we have doubled almost the statewide numbers. Again, this is a constant problem, and this is from our 2020 data. The 2022 data has not been concluded, but according to my communication with this particular department, we are still in top 10 and we're pushing top 5, which is a very scary thing considering there are less than 5% of our population, or 5% of the current population isn't even 5 years old yet. 21 and younger, less than 20% of our population hadn't lived yet we are almost double our statewide overdose deaths. I want that to sit in and set in with us to know that this isn't just a problem in one part of our county. This is a problem in every area of our county that we've got to make sure we give attention to. Another area for those individuals that say, well, this problem doesn't affect my house. I want to be very clear. When an individual goes to our emergency departments, whether they're in Reidsville, whether they're in Eden, Madison, Mayodan, wherever they are, and they don't have insurance, that individual who does receive treatment because they have to be treated for an overdose, that financial responsibility is not taken in by the hospital. It goes to the county. So our per capita income or our per capita responsibility, it doubles or it increases by ways that are astronomical. We can see on the right side, our statewide per capita, cost per capita is about $3,302. In Rockingham County, that number is $7,612. These are guesstimated numbers that are done by our Department of Health and Human Services. Help us understand that per person that comes into our emergency rooms that don't have insurance, we're going to be responsible for that. And I've just showed you we are doubling, almost doubling overdose deaths, emergency department visits in North Carolina. Small Rockingham County, least major problem. So how do we combat this problem in our community? We've got to leave here with answers. And that was one of my major responsibilities tonight, was to ensure that not only get education, but we also leave with answers. And so how do we combat this problem in our community? The first thing that we've got to do as a community is we've got to kill stigma of opioid usage and treatment options. What is stigma? The stigma is maybe this problem doesn't affect me. The stigma that says, oh, they're just drug addicts. Stigma also has a lot to do with our language. So I want you to just help me, and maybe we can help each other, that instead of we identify individuals that are struggling with opioid use disorder as just drug addicts, let's just identify them as a person struggling with drug addiction. When we make it personalized, it changes how we view that person, changes how we see that individual, and then it changes our perception of what's happening to another person in our community. We've got to kill the stigma of treatment options. I can remember 15 years ago when I first started in working in this particular field, the treatment program I was working with was in Greensboro at the time. and it was in a back road off in what I would call the corner of the city. No sign on the front door, no type of advertisement, hush hush thing, because no one wanted a drug treatment program in their community. I still face the same thing to this very when I try to ensure that programs into other counties and other cities within North Carolina deal with the same thing. The problem is their numbers are, if not worse, very similar to what Rockingham counties are. That means that we've got to embrace the fact that treatment options are available. We've got to kill stigma from the mere fact that opioid use disorder is not disease that we should shun away, but it has to be a disease that we embrace and say we want to be a part of the solution and a part of the problem. We've got to lean to proven education. I believe this is one of the areas in our particular county we've not done the best at. And that's providing ongoing education of what opioid use disorder is, how it affects the brain and body. What does it mean for my family? What does it mean for my children? How do I prevent this? Because prevention efforts are a major part of our education, which is my next point of reference. But education, I believe, is key to helping all of us understand this a little bit more so that we can find the focus to ensure that our families remain safe, even if this particular disease attacks a person in my family. We've got to have community and family support. I believe one of the things that I have always loved about Rockingham County is the family and community support. Okay, I'm biased. Reidsville has the best football team in all of the nation. I'm biased. The same type of intensity and tenacity that we see on football Friday nights has to be matched with energy when we address these particular problems in our community. Saddens me. Some things would get more attention in our county than other things that are so much more needed. Last thing is we have to normalize the community, the recovery community. The recovery community is a growing, evolving organism across the country. It's gotten more attention because of opioid use disorder, but the recovery community has been a community for a number of years. It has different facets in it, from those that are solely 12-step, solely abstinence-based, solely focused in prevention. There are many aspects of the recovery community, but nevertheless, community that engages and involves anyone that is striving for long-term recovery and sobriety. And I believe Rockingham County has to embrace that particular community and make it important to know that individuals that are struggling with opioid use disorder, we want you to be a part of their community and we want you to have that support. Next thing is dealing with the stigma. The hindrance of stigma is something that continues to combat us, and it draws lines in the sand. It prevents the ability to embrace and accept the fact that this problem is not just a problem for them, but it's a problem for all of us. Stigma prevents us from seeing things differently. Stigma creates a paradigm, and our paradigm, of course, are created by three major things. Paradigm is created by associations, education, and realizations. So who we are around, where we are, and who we hang out and fellowship with have a lot to do with what creates these types of stigmas. And so if addiction hadn't affected your family, maybe you know someone that has. And stigma means that I don't, killing stigma, means that I don't allow what TV has told me about addiction or substance use disorder, but I'll take some time to understand it, which goes into the harm of misinformation and miseducation. Misinformation can prevent a family member from getting the real help. Miseducation can prevent a family member from getting the good help. Misinformation will make you end the relationship because you don't understand substance use disorder. And these are the dynamics we've got to change and shift. No one wants to be left alone when they're fighting this type of demon, this type of beast. It is a dragon. What most individuals would relate to this particular disease is chasing a dragon. It's something that no one ever wants, but it's a battle that is needed to ensure that they have all individuals that are in their life to be supportive for what they're trying to accomplish. So there are 3 treatment options in our community as we speak. And I wanted to make sure that, again, we not only educated you, but we also leave you with answers. We have the Rockingham County Governmental Center. That phone number is present there. They provide assessments. They do provide referrals. They do provide some senses of substance use disorder. And I wanted to ensure that we provided that information. North Carolina Wellness Reidsville, they provide treatment as well for those that are struggling with substance use disorder. And then there is a Successful Transitions LLC, and they provide Suboxone and psychiatry. That is right there in the Madison-Mayodan area. These 3 are the only 3 that I could find that would identify opioid use disorder specifically. Because not all treatment programs address the same problem. But what this means, though, is that we don't have enough. With 91,000 people and with populations that we have represented, 3 treatment providers are not nearly enough. We have to have more. So some of the issues that are preventing individuals from even going into treatment, these are these barriers. Treatment options that cater to all cultures. That's always a looming problem in most cities across the country. That treatment centers answer or is a beacon light to one particular culture, but not all. I just showed you that we have a multiplicity of cultures that are represented here. That this disease does not discriminate. It affects everybody. So with ensuring that we are catering to all that are represented, we have to have multiple options cater to all cultures. Transportation is a problem here. One of the things that I do like, have a small bus line, but unfortunately there are still very rural areas in Rockingham County that create a barrier for people to go into treatment. There are treatment programs in Greensboro. Some of the people that need treatment right here in Rockingham County don't have reliable transportation to get to Greensboro. Much so, some of them can't make it up to the other side of Rockingham County. Let's be honest, transportation is a challenge here. So I believe if we can provide an answer to transportation, maybe we can increase the ability of individuals to seek out care right here in our county. Stigma, family dynamics that shy away from treatment. One of the most heartfelt things that I've dealt with since being in the county over the last 3 years of providing treatment here is the generational treatment that we provided. And what I mean by that is we have unfortunately been able to provide care and treatment, and I say unfortunately with the most empathy and compassion, because I never ever like to see it, but we have to provide an answer. We treated a mother, her mother, and the granddaughter. It was 3 generations we were providing. That's part of the issue and problems that we have in Rockingham County, is that we have multiple families that are struggling with the same problem, but no one wants to get help. No one wants to get help because they would rather stay in their own home and struggle with this problem because they don't want the town to talk about them. I believe Rockingham County still possesses some heartfelt individuals that says, I'm beyond the old stigma, that I want to be a part of this solution, and I want to ensure we're providing the best quality care, which means the lack of community support for the recovery community has to change. We've got to increase to ensure that we have recovery days, that we do recovery marches right here in Rockingham County. We provide a day where we focus on those that have lost their lives to addiction, to substance use disorder, or to overdose. And so when nationally, there is a National Overdose Day, we want to make sure we are part of the recovery community. That's an area we've got to give attention to, because when we make it a big deal, other individuals will make it a big. Last thing is to remove the barriers, and we move one step closer to giving a loved one, family, or friends an opportunity to live. That's again to ensure that we're providing the best support possible in every area that we can. The importance of a consistent of this particular consistent aspect is that we need a voice, and we need someone that's going to speak to the nature of what that we need for our county. And Rockingham County must have a consistent voice, someone that's on our behalf to ensure that we have the finances, to ensure we have the access to resources, to ensure that we have someone speaking on our behalf. This problem is not going away. We have to have somebody that's going to be present with us. So in summary, Rockingham County is blessed with some amazing people and families. I believe this. This disease of addiction called opioid use disorder doesn't discriminate. It attacks everyone it can. Opioid use disorder is a right now problem that we've got to address. This disease is affecting citizens of Rockingham County, and I want to make sure that we all understand it's affecting all of us if it affects one of us. We fight this problem by killing stigma, killing misinformation, killing miseducation. Rockingham County does have treatment options. However, we must have more. There are just too many barriers and too many gaps between a person getting to treatment and a person needing treatment. We've got to shorten that gap to ensure that there are no excuses for why people can't come and get into treatment. We've got to ensure that the present barriers are removed that makes treatment difficult to get to. And lastly, Rockingham must have a consistent voice that speaks up for us concerning this problem. And I believe Mr. J. Donecker is that voice. These are some of the resources that I was blessed to be able to use. And that's, of course, from our ASAM, from our census, the National Institute on Drug Abuse, the North Carolina Injury and Violence Branch, and of course, our World Health Organization. I want to take this time again to thank you all for listening to my little Easter speech this evening. And I hope that this has been informative, but even more, I hope that it has encouraged you to become a part of the solution to an ever-growing problem.
Dr. Flack, thank you very much for such an informative presentation. There don't appear to be any questions in the chat, but I do have one for you. When you stratify people's lives by decades, 0 to 10, 10, 20, 20 to 30, in Rock County, which decade is most represented in dealing with opioid use disorder?
Excuse me, I'm sorry, I'm trying to get back to the main screen. The population that I've seen that's most represented have been two. That's 18 to 25, and then 50 to 65, those that are directly struggling with opioid use disorder in Rockingham County. Those are the ones that we've been able to see that are actually actively coming into treatment. There is that gap where those individuals between 25 and 50, some come, but it does not mean that there aren't more.
Right.
I think that gap there is individuals who want to come to treatment, but due to stigma, prevents them from coming to treatment?
Yeah, I asked that question because I agree that both are probably tips of the iceberg. But
Yes, sir.
in the misinformation, too many people think that this opioid use disorder has started from experimentation.
Oh,
And
wow.
when you start dealing with people who are 55 to 65 wrestling with this disease, there has to be a component that acknowledges that some may have, and then unfortunately were not able to continue their medication, or the medication actually became less successful in treating their initial disease. I also would like to make the point that I'm really glad you called out that this is a disease. This is not something that a person has a behavioral defect. It's a disease that is present that has to be looked upon as a disease, and public-private partnerships such as what you're involved with would be very beneficial for Rockingham County.
Yes, sir. I agree 150%. Number one, the opioid crisis increased greatly from the unfortunate prescription pads of physicians that did not provide what we as providers have to do, and that's what we call CSRS checks, and that is controlled reporting systems checks. Anytime a person comes into our drug treatment programs, we have to run a dialogue of their pharmaceutical requests of medications that have been provided to them over the umpteen years that they've ever prescribed medication. This gives us a download of what their history has been of prescriptions that have been provided to them. The reality is, Mr. Donecker, is that most individuals that we have treated in this area didn't start by street drugs. They came from a prescription from a bad hip, a hurt back, a football injury, working, because again, Rockingham County, they're hard workers, construction workers, those that have labored. I remember when the American Tobacco Company was open, one of the greatest times is the 90s of Rockingham County, but then also one of the most hardest times was when the American Tobacco Company got shut down. And it was like the soul of the city had been sucked out because all of the major jobs was at that factory. And so a lot of people began to turn to other options to deal and cope with that. And unfortunately, individuals that had had injuries and hurt and things of that nature, the only other options that they turned to once the prescription pads ended was street drugs. And that was a problem that, again, we continue to see even today.
Oh, great. I will give one more chance for anybody to ask a question of Dr. Flack. Otherwise, I would like to thank you again, Dr. Flack, for taking the time to educate us.
Yes, sir.
I hope to hear more from you in the months to come. I know that there is an opioid focus group that is going around our county right now that our county health department has spearheaded. And I hope that that raises the awareness as well as make people understand that we have to do something better from Raleigh so that our care of our residents is locally executed, because we have a much greater sense of embracing our neighbors as they go through this disease program than having them go elsewhere out of the county.
Yes, sir.
All right.
Yes, sir.
With that said, thank you, everyone.